Linda Jackson again with Dr. Himsel, and we're having our back to school chat about topic after topic after topic, and this one may interest you, guardians and parents there at home. Dr. Himsel, if parents choose on-site instruction, but cases progress significantly, cases of COVID, will you close the school, or do you even have the capacity to shift gears to perhaps all remote learning at that point?
Well, first off, do we have the capacity to shift and pivot into remote learning? I think last year, March 13th to March 18th, in that 5-day period of time, we proved that we can do that. As difficult as it was, we did it, and we did it because we've got we're blessed with just so many dedicated people here who want our kids to do well. In terms of how cases progress, there's some terms we need to start getting used to. There's the term isolation, which is a term that's going to be used when we have a confirmed case of COVID. So if your child has a confirmed case of COVID, the health department is going to say that you need to isolate them or keep them away from other people as much as possible so it doesn't spread to other people. There's also going to be the term quarantine. The term quarantine means your child's healthy. As of right now, they're not sick. But we know that they've been exposed to somebody who does have a confirmed case of COVID. And the way they rule that is what they consider high-risk exposures. High-risk exposures are less than 6 feet apart for more than 15 minutes. So all of our classrooms are going to have seating charts. We're going to have lots of procedures in place so that we don't have an intermixing of a lot of kids on a regular basis, so that if we have a confirmed case, we can limit and make as small group as possible that is within that 6 feet distance, so that we have the smallest number possible that gets quarantined. Because that's the interruption to the school year that we're going to try to avoid and try to do that. So that's why we're going to have seating charts. That's why we're going to try not to have the first grade eat lunch and not intermix with the second grade. And then the second grade comes down and they don't intermix with the third grade. That's why at the middle school and the high school cafeterias, we're going to have the tables spread apart as far as we can get them. Whenever it's possible to have seats in between that are empty, we're going to try to do that. We need kids to help us with that. When I watch them out right now, they're doing what kids do. They forget, and they get close together, and what they're doing when they get close together is if one of them unknowingly has it because they came in contact with someone who they did not know had it, they're exposing all their friends who are close by to possibly needing to be quarantined. That's why wearing the mask, that's why maintaining distance is so important. We are doing everything within our plans is to minimize the number of people who might need to be quarantined so that we can avoid an entire class being quarantined or an entire grade level being quarantined or an entire school. But it's the Allen County Department of Health that will make decisions regarding quarantine. It will not be us. We will work with the Allen County Department of Health. We will maintain all the HIPAA requirements and stay within all that and provide them with the information they need to make sure our community and our public at large is as safe as possible so that they can contain as many of these cases as possible so it's not out in our community being spread to other people. But they have to live within the guidelines of the Indiana State Department of Health. So they're rules followers. That's what they've been charged to do. They're going to follow their rules. They've got flow charts that they do to determine who gets quarantined and who doesn't. The last term that our parents may need to get used to is called self-monitoring. And self-monitoring just means monitor your health, monitor your symptoms. At this point in time, what's been a doctor gave me the advice that it's so widespread in parts of our community and throughout parts of our state, it's in our best interest just to always be self-monitoring. Just constantly monitor your symptoms. The number one thing that we can do, the number one safety thing that can be done, and we haven't talked about it yet, is stay home when you're sick. If there's nobody with a case of COVID in our schools, then we don't have to worry about whether or not someone forgets to put on their mask or forgets to be social distance. But because we don't always know, we're going to be wearing our mask and we're going to try to maximize those physical distances because it's possible that you don't even know you have it. and you come to work and so forth because you don't show any symptoms. And that's what makes this very complicated. We're used to the flu when we start feeling bad, and when we start feeling bad, we know to stay away from people, or you notice that they don't look like they feel well, so you stay away from them. COVID's a little bit different in that the symptoms aren't always obvious. For some people, it's a very serious illness. For others, the doctors have reported they may not even know they had it because it was so mild. So it's what complicates it and makes it hard. But if you have the symptoms, if you are sick, you need to stay at home. And we have adjusted our attendance policies and put in some flexibility so that they're not penalized because they're doing what's best for the entire public.